Not all scoliosis curves behave the same way. Some curves remain relatively stable for years, while others continue to progress during growth and even into adulthood. Research has identified several important factors that influence the likelihood of progression. One of the strongest predictors is skeletal growth remaining in the patient. Children and adolescents who have significant growth remaining, particularly during growth spurts, are at a higher risk of curve progression because the spine is rapidly changing. Larger curves at the time of diagnosis are also more likely to worsen than smaller curves. Studies by Lonstein and Carlson found that age, skeletal maturity, and initial cob angles are among the most important factors in predicting progression risk. The location and shape of the curve may also influence progression. Thoracic curves and double major curves tend to have a greater tendency to worsen compared to lumbar curves. And research has also shown that spinal rotation and three-dimensional deformity play very important roles. A scoliosis curve is not simply a side-to-side bend. It involves vertebral rotation and changes in alignment from multiple directions. Increased vertebral rotation and trunk imbalance have been associated with a higher risk of progression. And additionally, genetic factors appear to contribute, which may help explain why two patients with seemingly similar curves can experience very different outcomes. While growth, curve size, and genetics influence progression, early intervention may help reduce the risk of worsening in some patients. Scoliosis-specific exercise programs such as ScoliBalance, bracing when appropriate, and regularly monitoring allow clinicians to identify changes before significant progression can occur. Because each scoliosis case is unique, predicting progression requires consideration of multiple factors, rather than relying on cob angle alone. This highlights the importance of comprehensive evaluation, including assessment of posture, rotation, flexibility, skeletal maturity, and of course, radiographic findings, which is always our focus at Scolicare Louisville.